But for breast cancer survivors, this is even more isolating. They especially may be left feeling like they have no help to deal with the physical and psychological changes affecting their intimate life. So what can breast cancer survivors do about issues down there like vaginal dryness and painful intercourse and vulva pain? October, we wear pink for breast cancer awareness, which affects 1 in 8 women. One thing not so often discussed in breast cancer survivors are sexual side effects that are common after breast cancer treatments. It's clear breast cancer treatments can have a significant impact on one's overall psychological and physical well-being, but it can significantly impact a person's overall sexual health. Between 50 to 75% of breast cancer survivors develop what we call vulva-vaginal atrophy. This is where the tissues in the vulva, that's the outside of the vagina, and inside the vagina change. They become less elastic, less lubricated, thinner, more fragile, more irritated, and more prone to infections. So women will complain of symptoms like vaginal dryness, itching, burning, pain with intercourse, and recurrent UTIs. Now, vulvovaginal atrophy also happens in menopause, but for breast cancer survivors, the symptoms are generally a lot worse or more severe than with just postmenopausal women. So it's like menopause turned up 2-3 notches. We know far too often women have little answers when it comes to our sexual dysfunction and are left feeling hopeless and just resigned. But for breast cancer survivors, this is even more isolating. They especially may be left feeling like they have no help to deal with the physical and psychological changes affecting their intimate life. So what can breast cancer survivors do about issues down there like vaginal dryness and painful intercourse and vulva pain? Well, highly accessible are personal vaginal lubricants. We know them: KY Jelly, Uberlube, Astraglide, etc. These provide short-term, on-demand lubrication specifically for penetration or intercourse. Silicone-based lubricants may be more favorable to water-based lubricants because they last longer. Water-based lubricants dry out and need to be reapplied. There are also vaginal moisturizers, which are not the same as lubricants. Remember, lubricants are to lubricate in the moment, on demand. Vaginal moisturizers try to increase water content into the tissues. These are also found over the counter, and again, they increase water absorption in the vaginal mucosal cells or the vaginal lining. One example is a brand called Replens. Then there's vaginal estrogen, which is the holy grail of treating vaginal dryness in postmenopausal women. But what about breast cancer patients? They are often told no estrogen for the rest of their lives because of the potential risk for breast cancer recurrence, particularly if they're estrogen positive breast cancer. Well, here's the deal. Vaginal dryness can be safely treated even with hormone positive breast cancer patients with local vaginal estrogen. It actually has not been shown to increase the risk of breast cancer recurrence. It has been used safely in breast cancer survivors to help with vaginal lubrication, painful intercourse, and recurrent UTIs. It is super important, though, that vaginal estrogen not be started without the blessing or consulting the patient's oncologist or the specialist managing their breast cancer. I have several patients that I use vaginal estrogen on, and I always consult the oncologist if the patient has had a history of breast cancer. Most of the time, the oncologist and I are on the same page and can safely use vaginal estrogen to help my patient. In fact, in 2016, a committee of the American College of Obstetricians and Gynecologists quoted data showing that low-dose vaginal estrogens do not result in sustained serum or blood levels of estrogen exceeding the normal postmenopausal ranges. That means that vaginal estrogen did not increase levels of estrogen in the blood from what was expected in a postmenopausal woman anyway. Furthermore, the use of vaginal estrogens did not increase the risk of breast cancer. Now, they do recommend caution in using it with patients who've had a history of breast cancer, but this is where weighing the risks and the benefits, and particularly making sure the oncologist is on board, is important. Now, some patients and physicians are still going to feel completely uncomfortable using vaginal estrogen, even with this data and with evidence that it does not increase the risk. And this is understandable. So there are alternatives that are non-estrogen. Ospemifene is a non-hormonal oral pill indicated to treat vaginal dryness with or without painful sex. It is what we call a selective estrogen receptor modulator, or SERM, meaning it acts against estrogen in some tissues in our body and acts pro-estrogen in other tissues. So, for instance, it has an anti-estrogen effect in the breast, okay? And it has a pro-estrogen effect in the vagina, making it a potential attractive option, particularly for breast cancer survivors. Vaginal DHEA is a vaginal suppository using dihydroepiandrosterone, DHEA, that gets converted to estrogen in the vagina. So it is non-estrogen, but it gets converted in the tissues. It too has been used safely in breast cancer survivors. It is important to note that all of these options listed do come with warnings on the label for breast cancer patients. Despite medical societies imploring the FDA to reconsider the warning labels, they still come with these warnings. Okay, Dr. Milhouse, I want an option that has no warning labels on it when it comes to breast cancer. Well, then consider vaginal hyaluronic acid formulations. So far, there is limited evidence that they improve vaginal dryness similar to using vaginal estrogen. Okay, but what about laser therapy? Vaginal laser therapy has become extremely popular, most commonly carbon dioxide lasers. And they work by stimulating collagen production in new blood vessels in the vagina, which can increase the quality of the vaginal tissue. Now, initially, lower quality research was favorable for lasers as a treatment for vaginal dryness symptoms. Great. Unfortunately, there have been 2 higher quality research trials that have come out and have shown it to be ineffective in improving vaginal dryness and painful sex symptoms. So at this point, lasers are coming more into question specifically for vaginal dryness and painful intercourse symptoms. Okay, great, Dr. Milhouse. You've helped me with my vagina. That feels better, but I still have no interest in having intercourse thanks to the aftermath of my breast cancer treatment and post-breast cancer life. Well, there are medical options. There are FDA-approved options, including Addyi or Vyleesi. There is also off-label testosterone, and testosterone can be used selectively in certain women and has not been shown to increase the risk of breast cancer in survivors. Now, any medical treatment I strongly feel should be combined with psychosocial counseling with a licensed professional. Low libido is often more complex in breast cancer survivors, dealing with the psychological impact of their disease and their treatment, also dealing with their new body after treatment. So many survivors report feeling disconnected from their own bodies and experiencing loss of sexual self-confidence and sexual self-esteem. So these licensed therapists and counselors are absolutely essential in working with individuals to help them regain a sense of self and help them improve their overall desire, arousal, and orgasm. October is Breast Cancer Awareness Month, and that includes surviving breast cancer. If you know somebody with breast cancer, please share this video with them. Would love to hear your comments. And as always, I look forward to seeing you next week right here for all things down there. Bye-bye.